On June 14th, 2009, a doctor burdened with nearly $500,000 in debt signed on to oversee the medical care of Michael Jackson just 11 days before the singer's sudden death. Hired at $150,000 per month, Conrad Murray stepped into a world where every decision would matter. But what really happened inside those final days, and why did events spiral from a lucrative contract to a criminal conviction? The answers reveal a chain of choices and oversight that changed music history. The employment agreement between Dr. Conrad Murray and AEG Live was formalized on June 14, 2009. The contract, later submitted as evidence in court, set Murray's compensation at $150,000 per month. The payment was not routed to Murray personally, but instead to his corporate entity, GCA Holdings. This structure placed AEG, not Michael Jackson himself, as the responsible party for Murray's salary. The contract was retroactive, listing May 1st, 2009 as its effective date, and it would expire automatically at the end of the This Is It tour. The document outlined Murray's duties in plain terms. He was to provide general and emergency medical care to Jackson throughout the duration of the tour. The agreement also specified that AEG would supply housing, travel arrangements, medical equipment, and insurance for Murray's work. Internal AEG budgeting memos entered into the trial record corroborated the $150,000 per month figure and identified Murray's role as a fixed line item in the tour's financial plan. A critical clause in the contract clarified that payments would flow directly from AEG's accounts to GCC Holdings, bypassing Jackson's personal finances entirely. That arrangement was reinforced in an email from AEG executive Paul Gongaware, who reminded Murray that AEG, not Jackson, was paying his salary and expected him to fulfill his obligations accordingly. The contract contained no explicit renewal language. Its terms would end with the final concert unless renegotiated. These contractual details established a clear legal framework and chain of accountability, placing financial and operational control squarely with the concert promoter. Conrad Murray's financial problems were neither hidden nor trivial. In the 18 months before his hiring, court judgments against his Nevada medical practice exceeded $400,000. These included a $228,000 vendor finance judgment, $135,000 owed to a leasing company, and $71,000 in educational loan defaults. On top of that, Murray faced a court order for $3,700 in unpaid child support and nearly $1,000 in traffic fines. Credit card debt and other personal liabilities pushed his total obligations to around $500,000, with some reports placing the figure closer to $780,000 when all creditors were counted. Civil dockets from Nevada and California courts show a steady stream of lawsuits and collection actions, most unresolved by June 2009. Investigators later seized financial records from his Houston office, confirming the scale of his debts. At the time he accepted the $150,000 per month position, Murray was already under pressure from creditors and at risk of further legal action. No bankruptcy had been filed, but the threat of new judgments and wage garnishments loomed. This backdrop of mounting liabilities cast the AEG offer in a different light. The salary promised a lifeline, enough to cover judgments and satisfy creditors, at least temporarily. It also meant that losing the position would have immediate, severe consequences for Murray's financial survival. These pressures shaped the environment in which he made clinical decisions. setting the stage for choices that would later come under criminal scrutiny. Inside Michael Jackson's rented Holmby Hills mansion, the routine was anything but ordinary. For roughly 60 nights leading up to June 25, 2009, Dr. Conrad Murray administered propofol intravenously to Jackson. Each session was intended to induce sleep, and each one was performed without the safeguards standard in any hospital setting. The anesthetic, typically reserved for operating rooms and intensive care units, was delivered using a basic intravenous stand set up next to Jackson's bed. There were no heart monitors, no pulse oximeters, no capnography devices to track breathing or oxygen levels. Murray worked alone with no nurse or qualified backup present. According to trial records and expert testimony, Murray's protocol involved an initial bolus dose of 25 to 50 milligrams, followed by a maintenance infusion adjusted by hand. The American Society of Anesthesiologists had issued clear guidelines by 2009. Propofol should never be administered outside a hospital or surgical suite without continuous monitoring and immediate access to airway management equipment. Yet in Jackson's bedroom, none of this was available. No crash cart, no defibrillator, not even basic airway tools. The only evidence of preparation was the intravenous stand and empty vials found at the scene. Each night's infusion increased the cumulative risk. Propofol's effects are rapid and unpredictable, with sedation arriving in less than a minute and respiratory depression possible at any dose. Without monitors, even a small miscalculation could go unnoticed until it was too late. Over the course of nearly 2 months, this nightly regimen transformed a private residence into a high-risk environment where the margin for error grew thinner with every monitored infusion. Shortly after the last dose of propofol, a crucial window opened inside Michael Jackson's bedroom. Phone carrier records and emergency medical technician logs later reconstructed the minutes that followed. At 12:02 p.m., Dr. Conrad Murray ended an 11-minute call with his Houston-based girlfriend. The call had been active while Jackson was already showing signs of distress. According to her testimony, she heard background noises, then silence before the line disconnected. Instead of dialing for emergency help, Murray sent 2 text messages at 12:03 p.m. and 12:04 p.m. He then placed another outgoing call at 12:12 p.m., this time to Michael Jackson's personal assistant, Michael Amir Williams. The voicemail left was urgent but did not mention a medical crisis or request an ambulance. Williams would later tell investigators that Murray never asked him to call 911. The official 911 call was not placed until 12:21 p.m., 21 minutes after Murray first discovered Jackson was unresponsive. By the time paramedics arrived at the mansion, Jackson had no detectable pulse. Emergency medical technicians documented that he showed no signs of life and had likely suffered cardiac arrest well before their arrival. This 21-minute gap became a focal point in the investigation and trial. Every minute lost in cardiac arrest reduces the chance of survival, especially when powerful anesthetics like propofol are involved. The phone log evidence, corroborated by emergency medical timelines, established that Murray made 3 personal calls before seeking help. The delay would form the basis for the prosecution's argument that Murray's actions crossed the line from error into criminal negligence. Internal AEG live communications revealed a corporate mindset focused squarely on payment logistics rather than patient safety. On June 14, 2009, Paul Gongaware, a top AEG executive, sent an email to Dr. Conrad Murray saying that it was AEG, not Michael Jackson, who was paying his salary. The message, later submitted as a trial exhibit, left no doubt about who controlled the financial arrangement. AEG executives tracked Murray's compensation as a fixed expense in the tour's budget, referencing him by name and by line item, yet the correspondence contained no mention of medical oversight, risk protocols, or patient care standards. The paper trail showed a promoter intent on keeping its physician on task, but silent on clinical safety. In court, these emails became evidence of a system where financial control was clear, but medical oversight was absent. The Los Angeles County Coroner's toxicology report delivered a clear conclusion. Michael Jackson's blood contained 9.8 micrograms per milliliter of propofol, a concentration seen in surgical anesthesia, not sleep therapy. Alongside the propofol, 5 other drugs were detected: midazolam, diazepam, lorazepam, lidocaine, and fentanyl, each prescribed from different pharmacies, each adding to the risk of respiratory failure. Forensic analysis traced these medications through pharmacy invoices, linking every vial and tablet directly to Dr. Conrad Murray's orders. The coroner's findings left little room for doubt. The combined effect of these drugs, administered without proper monitoring or emergency equipment, resulted in fatal respiratory depression. In November 2011, a Los Angeles jury found Conrad Murray guilty of involuntary manslaughter. He was sentenced to 30 months in state prison, but served less than 2 years before release. The verdict closed the criminal case, but the medical and ethical questions remain. Medical decisions made under financial strain and without oversight can end in tragedy, no matter the patient's fame. Today, the case stands as a warning. When accountability breaks down between doctors and corporations, the consequences reach far beyond one life. Let me know your thoughts below.